patient was placed in supine position and the right lower limb was prepared in a routine manner.
First, the arthroscope is introduced into the posterior medial compartment through the trans-notch approach from the anterior-lateral portal. After identifying the posterior medial soft spot by finger tapping, an 18-gauge spinal needle is subsequently inserted in the posterior aspect of the medial femoral condyle 5 mm behind parallelly. After capsular enlargement with a hemostat, insert transparent cannula 5.75 millimeters. A posterior lateral portal is then created in the same manner. A switching stick is inserted through the posterior medial portal, and placing the arthroscope at the 9 o'clock position, but not beyond the posterior condyle, the switching stick is gently passed through the posterior septum in the direction parallel to the posterior condyle. After placing the arthroscope in the posterior lateral compartment, the switching stick was passed through the cannula of the posterior lateral portal. While sliding the switching stick in the posterior medial direction, an instrument was inserted into the posterior lateral portal. Then, push both cannulas towards the posterior septum and fix the cannular direction while the switching stick was slid into the septum. Owing to the fixed cannula, abrupt processes can be limited during posterior septum resection. The switching stick was penetrated again after the resection of the posterior lateral side of the posterior septum. After positioning the arthroscope back in the posterior medial compartment while sliding the switching stick into the posterior lateral compartment, an instrument, shaver or RF, was inserted into the posterior medial portal. Push both cannulas towards the posterior septum and fix the cannular direction while the switching stick was slid into the septum, and the posterior septum was resected in the posterior medial compartment by using an instrument, shaver or RF. All the courses were controlled safely and stably under direct visualization. The arthroscope and instrument were inserted respectively posterior medial and posterior lateral portals to achieve direct posterior-posterior triangulation. Exchange the arthroscope each of the posterior medial and posterior lateral portal. Now the posterior septum resection is complete. Thank you for your attention.